Well, there are three things that need to underpin the way that the NHS Commissioning Board works. Firstly, having patients at its heart. Secondly, building a clinical commissioning system for the NHS. And thirdly, promoting and supporting the values and principles set out in the NHS Constitution.
Clinical commissioning groups are all about engagement, engaging with patients, engaging with partner groups such as the local authority and the hospital, and in particular engaging with practices.
The difference here is actually the accountability being given to clinicians.
I think there's a real opportunity for clinicians to step up to the plate and start to make the changes that are required.
Patients feel quite strongly that they want to be an active part of their treatment.
We can work closely with the GPs and say, well, actually, what is it that the people of Sandwell need in a holistic sense that we can together deliver? Bringing those perspectives together, the whole population, the whole individual, that gives us the opportunity to really take things further.
A lot of GPs are really linked into their local area, and we have a passion not just for the patients but to see the area thrive.
What we're already seeing on the ground is clinicians working together and starting to work more collaboratively, not only across primary care but also across the primary care, secondary care divide. And this is particularly around things like the integration of care in community services.
We're looking at what's people's life experience, because we want people to have a good quality life, high quality well-being for the maximum length of duration that we can possibly achieve.
I think it's very important to listen to patients, and I think it's moving very much in the direction of a joint decision-making process.
The new partnership with the local authority on the health and well-being boards brings a new added strength to patient-public involvement.
It was the first time that I had seen people at a decision-making level, all together in the same room with people from the community.
True engagement, involvement of patients it's difficult to do, but I think is probably fundamental to the success of having clinicians and patients working together.
We work very closely with local authority and secondary care to work out, define the needs of the population.
We can design services that meet the needs rather than needs meeting the services.
There's obviously key partnerships and stakeholders in the current health economy which we need to strengthen. The emerging health and wellbeing boards being crucial to setting strategic direction.
There is significant flexibility for us to do locally whatever it is that works for us, rather than fitting some national template.
Because as we move forward together and we actually get a common vision and common purpose, I think that will help us to succeed in our ambitions.
We've got a real opportunity to build an organisation which can lead the NHS through the challenges of the future to ensure we get the best possible outcomes for our patients.